Hi, Grace Rizza here. I'm excited to share three main things that patients want. It reminds me of that scene in The Notebook where he's yelling, "What do you want?" Patients present in a very complex way. They have lots of things to complain about, be indirect about, and it can be absolutely difficult taking care of the general public. But today I'm hopeful to make your life easier with these three quick tips. So, number one, patients want you to take your time with injections. If you speed through the rest of the clinical protocol, but you just take your time at the beginning when you're getting the patient numb, their overall experience will be much better. If you start the experience with a quick shot and a jab and it hurts, you've lost the patient's trust right off the bat. They're going to be tense, they're going to be uncomfortable, and the rest of the treatment is going to be uncomfortable. So make sure you take your time when you're getting started with a patient. Number two, they don't want you to judge them. They want you to accept them. They want you to validate their feelings and their reasons and their excuses. And to you, it might be BS. But they want to feel important and they want to be valid. They want to be validated. So if they come into your practice and they want to talk to you for a few minutes about their past dental experiences, about why they haven't been to the dentist in a while, or any other reason why they have a genetic predisposition to poor oral health and oral health conditions, it is not worth your time to roll your eyes, to accuse them internally or externally of telling the truth or not. In most situations, I believe people are telling the truth from their perspective. It might be a lack of education, might be a lack of good, proper oral hygiene, but whatever it is, validate them. We're so happy you're here. What brings you in today? How can we make you smile today? Listen to them, acknowledge them, validate them, and then let them know that you're here to help. And you're so glad that they came in today because you are honored to be the dental professional that helps to change their perception of dentistry, or to help to get them out of pain, or to come up with a plan to get them to a point of optimal oral health. Whatever that may be, put yourself on the side of the solution. Don't fight with them over the cause or the problem. And if you're feeling apprehensive about the advice I'm giving you, I want you to know this doesn't mean don't educate the patient. You should have a lot of education in your practice. You should have a full page flyer or brochure on every single service that you offer. You should have very detailed, personalized post-op instructions for your patients. This is actually one of the biggest missing areas of opportunity is internal guides and internal protocols so that you can educate the patient without making them feel judged or uncomfortable. When they see it on something printed, they know this is just a part of your ongoing process. When it comes out of your mouth, it feels like a lecture. So there are different ways to educate the patient where you don't put yourself in a position of opposition to them. You are putting yourself on their team. It's really, really important that you do that to build trust with the patient. And number three, they want open, honest communication. So if a patient comes in for a comprehensive exam and you spend 10 seconds just glancing at their mouth, you didn't do an oral cancer screening, you didn't take intraoral pictures, because a lot of patients don't know what to ask for. They don't know what they should expect in a comprehensive exam. But all they see is they walk out and they have that $300 bill from that appointment, or 200 or whatever it is. And you don't explain what you're doing and why it's important to the patient, they're going to walk away feeling like they just got ripped off. That's why you have patients who come in and say, I don't want x-rays, I don't want probing, I don't want the oral cancer screening. No one says that, by the way, you're just not doing it. You've got to do all the things to build trust in the patients. Don't take shortcuts. Excellent patient care and excellent patient experience. Everyone thinks they're creating this. Everyone thinks that they're doing the best they can possibly do. But unless you have your entire team on board with these four main core values, your patients may not be feeling the same. So number one, honesty. Number two, excellent communication. Number three, compassion, that you care about the person in the chair. And number 4, a dedication to growth. And if you need help with growing your dental practice, reach out to Identity Dental Marketing at identitydental.com. And I'm happy to offer you a complimentary growth strategy session. Thanks so much and have a great day.